guess the question is like, what is neurosurgery? What is organized neurosurgery? We know what neurosurgery is for the most part. So that's a really interesting question, because I didn't know when I was a junior resident and the like what that meant. Let's see if I can change this here. Washing out. It's a little better. You know, what is an organization, organized medicine, organized neurosurgery? So it's a group of neurosurgeons, in the case of organized neurosurgery, that have accepted the responsibility of serving the interests of all neurosurgeons, you know, and really their patients, and contribute to the neurosurgical needs of the society of a whole, and the society being human beings, not just neurosurgeons. So it's a kind of a group of people that are professionals that get together to try and work on the field, more or less, and improve patient care and education, et cetera. So this is in general what it is. So it involves advocacy for patients, advocacy for members, advancement of education, advancement of innovation and research, in short. And there's many other facets to what organized neurosurgery does, but like these are the obvious fundamental ones that I could come up with. So as far as within organized neurosurgery, you know, there's a large number of organizations that all have different roles, and there's two, you know, sort of big ones that do many various things kind of in parallel. So one is obviously the American Association of Neurological Surgeons. The other one's the Congress of Neurological Surgeons, right? So they do a lot of the same stuff, but they're kind of synergistic in a lot of ways as well. So one of the big things that they do every year, they're, you know, the deliverable, so to speak, that everyone sees is the 2 annual meetings. And these are important because they're like a forum for putting together the highest quality education materials and training for CME purposes. Presentations that advance the field, research and guidelines, et cetera. They also do advocacy for neurosurgeons and neurosurgical patients to Washington, D.C. to influence policy in Washington. They support subspecialty sections nowadays, which is important. So even though all of neurosurgery has a research and education interest, there's also a subspecialty research and education interest to be supported. And then they also both have a philanthropic arm for funding research and resident education and some degree medical student education as well. So I'm involved heavily with NREF, the NS's philanthropic arm, but also there's a CNS foundation, which does a similar work. And then both of these groups actually oversee, you know, major or the major scientific journals in the field. So they kind of adjudicate that as being like an authority to house that information in the direction of the journals. So those are the big ones. Now, they all do a lot more stuff than we talked about there, and they're complex and very important in what they do behind the scenes, in addition to just putting on the meetings. But that's some of what they do. There are other notable societies as well. So one big one is like the oldest society that was founded by Cushing, actually. AANS was founded by Cushing, if I recall correctly, also. Called the Society of Neurological Surgeons. And what they really do is that they're the neurosurgical arm of the GME. So I'm not sure if it's really fair to say it exactly that way, but their job is to conform neurosurgery resident education to like a standard. So the Graduate Medical Education Board. So they have to make sure neurosurgery education is excellent across all the residency training programs. The Academy of Neurological Surgeons is really into advancement of scientific discovery and research for neurosurgical diseases. So they're really a group of neurosurgeons that want to foster and advance scientific research in our field. So they get together and discuss those parameters, and you know, they've been very successful in advancing neurosurgical research funding, for example, along with many others, NREF, et cetera. I think we missed one. Yeah, so the Congress of State Neurological Surgeons. So every state has a neurosurgical society, and then they pass along concerns and resolutions, and then they all get together twice a year to discuss these resolutions and pass them, which then get moved along to the major organizations, CNS and AANS, and then eventually often to Washington, depending on what it is. But it's a way for the state societies to influence the direction of national neurosurgery. Slide is weird. And then the American Board of Neurological Surgeons, the ABNS, they oversee the written and oral neurosurgery boards. So those are a few other societies that are kind of arms of the major two that we talked about. And there's more. There's like the fellowship for CAST, standards, etc. But that's just an overview of some of these societies. But one thing they all have in common, interestingly, I didn't really think about this when I was, very junior, was every physician you see in any leadership position or committee, this is all volunteerism. So we, through involvement, and it's very prestigious to be involved, you're donating your time. So it has profound strategic implications for someone that wants to get involved in organized neurosurgery, just to think of it that way. People put a lot of time and energy away from their families, away from their practice, away from their research to push forward the field. And I think it's important to understand that's all volunteerism. No one gets paid for that. And that's important to know from like just a perspective of like that being very impressive, but also of how to think about leading in organized neurosurgery, for example, as well as how to get involved in organized neurosurgery.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.